Hello! It's me again, Julian D. Sernilia, your future register nurse. For today's video, I will perform the types of injection: intramuscular injection, intravenous injection, subcutaneous injection, and the intradermal injection. Okay, let's begin now.
Dermal injection is the injection of a tiny amount of fluid into the layer of the skin. It's usually done to test for drug sensitivity before administering larger amounts by other methods. The procedure: gather all the equipment needed and check the position order. Explain the procedure to the patient, the purpose, site for injection, and how he/she has to cooperate. Hello, Mr. Orange, di makain-kain. This is to test if you are sensitive into this drug. This injection administered into the dermis, just below your epidermis. So please cooperate and stay comfortable. Wash hands and don disposable gloves. Prepare medication from ampule or vial. 0.9 for sterile water. And after that, 0.1 for drug. Position the patient and select the inner aspect of the forearm. Cleanse the site with an alcohol swab in a circular motion, moving outward. Remove the needle cup with the non-dominant hand by pulling it straight off. Use the non-dominant hand to spread skin taut over the injection site. Place the needle almost flat against the patient's skin, or it is 10 to 15 degree angle. Insert 1/8 inch bevel up so that needle can be seen through the skin. Slowly inject the drug, watching for a bleb wheel to develop. If not present, withdraw the needle slightly and inject the medication. Or to the limit that you can form wheel, that's the time we can remove the injection. After that, withdraw the needle quickly in the same angle as it was inserted. Do not massage the area. Do not recap the needle. Discard syringe and needle into the appropriate receptacle. Remove glove and wash hands. Record the medication administration. The medication administered, amount, dose site, and patient's response. Draw a circle using blue or black pen around the injection site. Write the date and time of administration of medication. Take note that we do not use red pen to circle the wheel because we might misinterpret it for allergic reaction. Okay, today is March 8, 2021 and it is 7:30 a.m. The patient should watch at least 30 minutes for sign of allergic reaction. 7:30 a.m. kanina. Pabalik ako mga 8 a.m. The question is, what if there is a rashes? If there is a rashes, we are not going to administer the drug and we inform the physician right away for him to know that the patient is allergic to that drug. Intramuscular injection is a technique used to deliver a medication deep into the muscles. Steps for a safe intramuscular injection. 1. Wash your hands. Wash your hands with soap and warm water to prevent potential infection. 2. Gather all needed supplies. Needle and syringe with medication. Alcohol, cotton, puncture-resistant container to discard the used needles and syringe, typically a red plastic sharps container. 3. Locate injection site. To isolate the muscle and target where you'll place the injection, Spread the skin at the injection site between two fingers. The person receiving the injection should get into a position that's comfortable. Provides easy access to the location. Get into a position that's comfortable. Provides easy access to the location and keeps the muscles relaxed. 4. Clean injection site. Clean the site selected for injection with an alcohol swab and allow the skin to air dry. 5. Prepare syringe with medication. Remove the cup. If the vial or pen is multi-dose, take a note about when the vial was first opened. The rubber stopper should be cleaned with an alcohol swab. Draw air into the syringe. Draw back the plunger to fill the syringe with air up to the dose that you'll be injecting. This is done because the vial is a vacuum and you need to add an equal amount of air to regulate the pressure. Insert air into the vial. Remove the cup from the needle and push the needle through the rubber stopper at the top of the vial. Inject all of the air into the vial. Be careful to not touch the needle to keep it clean. Remove air bubbles. Tap the syringe to push any bubbles to the top and gently depress the plunger to push the air bubbles out. Insert the needle. Hold the needle like a dart and insert it into the muscle at a 90-degree angle. You should insert the needle in a quick but controlled manner. Do not push the plunger in. Check for blood. Using the hand that's holding the skin at the injection site, pick up your index finger and thumb to stabilize the needle. Use your dominant hand, the one did the injection, to pull back on the plunger slightly, looking for blood in the syringe. If you see blood going into the syringe, it means the tip of the needle is in a blood vessel. If this happens, withdraw the needle and begin again with a new needle, syringe with medication, and injection site. And if you don't see blood going into the syringe, the needle is in the correct place and you can inject the medicine. Inject the medication. Push the plunger slowly to inject the medication into the muscle. Remove the needle. Withdraw the needle quickly and discard it into a puncture-resistant sharps container. Don't recap the needle. And lastly, apply pressure to the injection site. Use a piece of cotton to apply light pressure to the injection site. You can even massage the area to help the medicine be absorbed in the muscle. Subcutaneous injection. Subcutaneous means under the skin. In this type of injection, a short needle is used to inject a drug into the tissue layer between the skin and the muscle. Choose a fatty area of the body such as the abdomen, back of the arm or thigh. Wash hands before cleaning the area with an alcohol pad. Wait for the area to completely dry before the next step. Take the cup of the needle. Throw the medication into the syringe according to directions on the vial. This usually means turning the vial upside down, then pulling the plunger back to suck in the medication. Tap the syringe to get rid of air bubbles. Pinch a fold of skin. Pinch the fatty area about 2 inches thick in between the thumb and a finger. While holding the needle like a dart, slide into the skin at an angle of 45 degrees. Push the plunger all the way down quickly. Do not push forcefully. Cover the needle. Dispose of the needle in a needle-safe container. Intravenous injection. It administered at 25-degree angle. This means medication sent directly into your veins using a needle or tube. Intravenous means into the vein. Prepare the medication, if necessary by drawing the medication from the ampule or vial into the syringe using a sterile needle. It is necessary to clean the top of a sealed vial. Remove the needle used to draw up the drug from the syringe and replace with a sterile 20 gauge or 21 gauge needle. Select a suitable superficial vein. This can also be done using ultrasonography, as when obtaining intravenous access. Wrap a tourniquet, usually on the upper arm, to fill the peripheral veins. Visualizing and puncturing a vein can be facilitated by warming the limb and massaging, or topping the planned injection site. Spread the skin taut below the planned injection site using a thumb or fingers of one hand. Make sure that you perform hand hygiene and don non-sterile, disposable gloves. Clean and disinfect the planned injection site using a single-use alcohol swab or single-use cotton with disinfectant solution. Start over the planned injection site and work outwards. Allow the disinfectant to dry completely. Spread the skin taut below the planned injection site using a thumb or fingers of one hand. Insert a needle with a syringe attached into the skin at a 25-degree angle, simultaneously aspirating the syringe plunger. When blood is seen in the syringe, release the tourniquet and inject the drug. This is usually done slowly, then withdraw the needle. Compress the injection site with sterile gauze immediately after the needle is removed to stop bleeding, then protect it with a small adhesive dressing. Let's assume that we have sterile IV solution. After we clear the perforated corner of the outer packaging, check color, clarity, and expiration date. Remove IV solution from outer packaging and gently squeeze. And then, IV tubing. Remove primary IV tubing from outer packaging. Move the roller clamp about 3 cm below the drip chamber and close the clamp. Careful and do not contaminate the spike. Remove the protective cover on the IV solution port and keep sterile. Let's assume that we insert IV spike into sterile solution using sterile technique, and we hang bag on IV pole. Okay, fill the drip chamber 1/3 to 1/2 full by gently squeezing the chamber. Remove protective cover on the end and tubing and keep sterile. Fill drip chamber with distal end of tubing over a basin or sink, usually open roller. Clamp to prime the IV tubing, invert that valve and ports as the fluid passes through the tubing. Tap gently to remove air and fill with fluid. Once IV tubing is primed, check the entire length of tubing to ensure the air bubbles are present. Close roller clamp cover and sterile bag under or sterile protective cover hang tubing on IV pole to prevent from touching your ground. Label tubing and IV bag with date, time, and initial. After that, we perform hand hygiene.